Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today's topic has to do with myths or facts. Sex prevents prostatitis, BPH, and prostate cancer. Yes, this has been an issue that people talk often about, but researches are very useful in confirming whether it is a fact or a myth. And there are certain researches that has been proven, for example, that eunuchs don't have the experience of prostate cancer or BPH, even prostatitis, probably because of the urethral stenosis. But it is easily explainable that eunuchs don't have been castrated. They don't have these testes that produces testosterone. So, and testosterone is the one incriminated in prostatitis and all these problems. So you can easily write that one off as non-meaningful. But there are better researches that has been done that I shall be exposing in this video so that we can have a deeper understanding of the facts about prostatitis, BPH, and prostate cancer, and how to prevent it so that we don't really come down with this kind of experience. If you like my presentation, press the like button, subscribe, and let's move on together into the slide section where I shall really explain and expose everything on these facts or myths. The outline: objective, introduction, research findings, laboratory diagnosis, prevention, and treatment are all I shall be speaking about. The objective: to debunk the notion that lack of regular sex causes prostatitis, benign prostate hyperplasia, or prostate cancer, while exposing the cause through laboratory diagnosis and the preventive measures advisable. The introduction: the prostate is walnut shaped and sits below the bladder in men. It is a gland, which means it secretes fluid, seminal fluid, through a duct as depicted in this picture. You can see the bladder, and below or beneath the bladder is the prostate. Just look at the arrow, and that is where it stays, and squeeze or constrict. If it's constricted, the urethra, which comes out from the bladder, would surely be constricted, and there will be serious pain or incontinence where you cannot find it easy to urinate. Prostatic fluid, along with sperm from the testicles and fluid from the seminal vesicle, make up the semen. The prostate secretion also include enzymes like PSA, which helps liquefy the semen after ejaculation, and other substances that support sperm health. As men age, the tissue that converts testosterone to dihydrotestosterone enlarges and constricts the urethra, just like I mentioned, thereby causing difficulty to urinate and reduction in the velocity of urine when compared to children's urination. Once there is a constriction, then the prostatic fluid that are produced accumulate there, and they are infiltrated by enteric organisms like E. coli, Klebsiella, Pseudomonas, and Enterococcus. They now infect and cause this serious inflammation called prostatitis. The risk factor category includes conditions that lead to lower urinary tract diseases, such as enlarged prostate, incomplete bladder emptying, the presence of bladder stones, urethral stricture, and paralyzed bladder muscle condition. So that's the first risk factor you want to really consider, and not necessarily you are talking of sex. So urinary stasis is the first that really cause that overgrowth of bacteria that cause the inflammation, the prostatitis. The next stasis could now be the semen stasis, that is the production, the accumulation of the semen, where you now want to be saying the accumulated semen could be ejaculated, so you encourage people to frequently ejaculate, but that is also due for discussion. Furthermore, There are other risk factors like the anal intercourse, where the problem it could result in transmission of naturally occurring bacteria in the rectum. Also, there is also the risk of prolonged sitting, especially over a long period, can be a significant risk factor for bacterial prostatitis. People who drive a lot, the long distance drivers. Yes, we must also recognize that any irritation of the prostate by parasites or bacteria, that is, even when you have urethritis, like also Trichomonas vaginalis or viruses or known irritants, all these have been implicated in prostatitis. People with chronic diarrhea, constipation, diverticulitis, or inflammatory bowel diseases are more likely to develop prostatitis. Prostatitis is usually acute, like I said, but if not treated, it may become chronic, causing enlargement of the prostate gland, regarded as benign prostate hyperplasia (BPH), with increased secretion of PSA, which may worsen to prostate cancer if not properly treated. Both BPH and prostate cancer are common especially with black people. About 1 out of every 7 men will be diagnosed with prostate cancer, and some believe that if you have not experienced it, probably because you don't live up to the age of experiencing it. Not generally anyway, probably 120 years of age or 127 as the lifespan is dictated. And 1 out of every 2 men in their 50s will have BPH. Like I said, it is very prevalent in black men. Yes, we are now on to the research findings to really understand whether it is just regular sex that cause prostatitis or not. This research will help to really open our mind. When we talk of celibates, the monks are regarded as celibates. The dietary and lifestyle habit of monks in the all-male community in Mount Athos have shown that regular consumption of olive oil, daily portion of fish, seasonal fruits and vegetables are among the main contributors towards keeping prostate cancer below international average. Data presented by urologist Haralambos Aldonopoulos showed it is not just the Mediterranean diet that helps, but generally a diet consisting of old traditional standards. Aldonopoulos said. He said he had examined hundreds of monks living on Mount Athos since 1994 and found that the incidence of prostate cancer was 4 times lower than the international average. The study found that in the last 13 years, there had been 11 reported cases of prostate cancer among the more than 1,500 monks living in the 20 different monasteries in the segregated community in northwest Greece, from which women are banned. If women are banned, then that means no sex. So other factors in the same study shown to keep prostate cancer at bay were the stress-free existence of the monks away from women, proper sleep patterns, and the lack of air pollution. Meals on Mount Athos are simple and do not contain meats, but fish is a regular fare of holidays and feast days such as Christmas and Easter. Just like in one of my articles, Healthy Aging, that we recommend that as from that age upward, one should change his diet if he wants to live elderly to over 70 years. Monks usually indulge in a glass of red wine, which is made locally from mountain grapes, with their dinner, but on fast days, Monday, Wednesday, and Friday, they abstain from wine, olive oil, and dairy products altogether. I had also exposed in one of my videos just jute leaf prevention of prostatitis, and that you can also check. Apart from also vitamin D, research showing vitamin D as very helpful in preventing prostatitis and calcium amongst other research findings in the past. Laboratory diagnosis. This is very instructive and very helpful, that if you know you easily produce semen, even at the site of women or what have you, you just need to visit the lab and let them test that your discharge and know whether it is already infected with the organism, because the urethra and the rectum are so close by that the organisms that E. coli, Klebsiella, and co. could easily penetrate, and that should inform that one should go for early regular treatment in that direction. For bacterial prostatitis, laboratory samples typically include urine. Pre and post massage, you may need to massage the prostate gland to get a discharge. Express prostatic secretion and potentially blood culture. A urinalysis and urine culture help identify bacteria and UTI. Like I earlier said, a semen culture will show signs of infection and white blood cell counts. Trichomoniasis could also be the problem. Lab diagnosis should include wet preparation in saline and culture in modified trichomonas medium incubated at 37 degrees for 3 to 7 days. Apart from staining with Giemsa, then the need to collect the biopsy once there is a BPH to really know whether it's benign or it has started metastasizing is also important. Other laboratory diagnosis like PSA will be very, very helpful. Now to prevention. The experience of prostatitis usually starts in men at 50 years of age, so it is advisable that lifestyle changes in terms of food, that is diet intake, as exposed by the Athos monasteries finding, will help prevent prostatitis, BPH, or prostate cancer. Prevention of lower urinary tract infection that could predispose to prostatitis, keeping faithful to one partner, avoid too much sitting, regular exercise, and eating of fruits and vegetables. And don't forget the Ewedu jute leaf that was recommended in my previous video. Now finally to treatment. From this exposition, it is a situation of acute condition to chronic condition, from prostatitis to benign prostate hyperplasia to prostate cancer, most likely from age 50 years and above. So it is not something that happens to the teens, or they are so free of it. So prostatitis has to do with inflammation and infection. So you need the culture to culture the infection, the samples, and use the appropriate antibiotic. For BPH, check the biopsy samples to confirm it's benign, and there are many procedures to remove it. Just like the one exposed here, like they are correcting the tissue, the hyperplasia tissue, here to create, to widen the constriction, to widen the urethral constriction. For prostate cancer, check that it has not metastasized to other organs before performing radical surgery that will remove everything. Treatment is a medical doctor's purview, so meet your medical doctor. And as I usually say, if you like this my presentation, there are many videos for you to watch. Just watch, enjoy yourself until the next presentation, the next production, which you can easily be in the know of by subscribing. So when you subscribe, you have, and I need feedback too. Let's have more feedback. Thanks.